Most COVID-19 patients fully recover from their infection, but a few endure unexplained health conditions for weeks or even months later. For more on this phenomenon, I have Professor David Kwok from Suncheon University. Professor Kwok, it's good to see you again.
Good afternoon, Sunny.
I also have Dr. Alice Hyung Tan at Ms. Medi Women's Hospital live on the line. Dr. Tan, welcome back.
Thank you for having me back.
Professor Kwok, the World Health Organization has made public its first official definition of the term long COVID. This was made back in October last year. Let's begin with this definition and perhaps a few words on the importance of having a standardized definition of long COVID.
Right. Well, let me begin with the importance of the standardized definition, because in order for any medical sector to treat a patient or a person showing certain symptoms, the symptoms need to be clearly defined for the medical doctors or nurses to decide to go ahead with the treatment. If those are not clearly defined, it'll be very vague and it'll be very hard for the medical sector to actually start taking actions or decide when to start taking the actions on certain group of symptoms. So the WHO made a definition that long COVID stands for those people who've had acute phase of COVID-19, possibly having the symptom last for about the next couple of months, but people who are continuing to show those symptoms even from third month and on, meaning 12 weeks, are now going to be considered people of long COVID. Those certain symptoms include anything from shortness of breath, fatigue, cognitive dysfunction. So these are all very usual symptoms that a person can show while having the acute phase of COVID-19. But if they continue to have those symptoms remain even afterwards, let's say 12 weeks afterwards, then they're going to be considered as a person having long COVID. But currently, several studies are showing that these symptoms are not only limited to only certain period after the 12 weeks, but they can actually be found to have it up to about a year of span, but possibly more, because we are also limited to the time of frame that we've studied these populations so far.
Right. And Dr. Tan, you've previously spoken about the need to focus on long COVID. Would you like to start by reiterating your thoughts?
Yes, so, even though statistically, right now we're in the midst of the Omicron wave, even though statistically Omicron may cause less severe disease or severe disease in fewer people, there's no guarantee that Omicron COVID will cause fewer cases of long COVID ultimately. And so I'm very concerned. Long haul COVID could potentially affect hundreds of thousands of people. And as Dr. Kwok just said, we don't know when long COVID may end. It might be indefinite in some people. It may be years that they have to suffer from these symptoms. And so many doctors are calling long haul COVID the next public health crisis. And I think it's great that we're spending time to have attention on this issue. Definitely, this is a health crisis that needs to be addressed and researched and talked about, so that people who have these symptoms can actually come out and talk to their doctors about them and not just wonder and suffer why they're feeling these symptoms on their own at home. That's not the situation that we want for our long-haul COVID patients.
Right, a very valid point, of course. Now, Professor Kwok, as you mentioned, some of the better-known symptoms of long COVID are brain fog and fatigue. What are some of the recently disclosed symptoms of this condition, and what are the implications of such findings?
Right, so people have been mainly speculating that there would be some other typical symptoms that from COVID-19 that we were bound to see sometimes afterwards, because mainly even with the acute phase of COVID-19, people are having issues with thromboembolism, meaning they're causing myocardial infarction. They could have caused cerebrovascular diseases and whatnot. And recently, a journal published in a very renowned journal called Nature has found that there were people having cerebral and cardiovascular problems in the long run of the COVID-19 after the acute phase. So they were having much greater chances of, let's say, people having cardiac issues such as heart failure, myocardial infarction, but also there were people who were having, let's say, brain strokes, much more commonly for those who've had COVID-19 before compared against those people who've not had COVID-19 before. They actually found those to be in the numbers of 50 to about 70% higher rates in those who've had COVID-19. So it clearly shows that COVID-19 impacts us in the long run, not just from the short acute phase. But it also found that people with different vaccination records, histories, and also people who's had it more severely against those who's had it mildly, incrementally show different severity of the symptoms, meaning people who've had it much severely with COVID-19 tended also to have much higher rate of these incidences that I just mentioned. They actually found for those people who were contained in ICU beds because of COVID-19 to possibly have 3 times as much of the possibility to have, let's say, heart-related diseases or brain-related diseases, and so on. So I think this study and many other different studies are also accumulating that clearly shows COVID-19 is not just a short-phase disease, but it can possibly impact us in the long run as well.
Right. Dr. Dan, keeping in mind what Professor Kwok has just said, so long COVID, the risks of long COVID, that is, appears to depend on the severity of your COVID-19 infection. Does it also perhaps depend on your age, would you say?
Yes, it can. But in terms of the severity and the proportion, so even though people who've had severe COVID, who are hospitalized due to COVID, they have a higher chance of having long-haul COVID symptoms. It was actually found that a similar proportion of people who had mild symptoms also complained of long-haul COVID symptoms 1 to 3 months after their acute illness. In terms of age, it was a myth that was believed that children did not have long-haul COVID after their acute infection. But a study from Italy showed that up to 51% of children complained of long-haul COVID symptoms, primarily tiredness, loss of smell or taste, and headache, 1 to 3 months after their acute illness. More than half of the children had these symptoms. And so certainly severity can play a role, but in terms of age, no one seems to be immune. In another study out of Harvard School of Public Health, it was found that up to 1/3 of people in the older population also had long-haul COVID symptoms, including dementia, post-viral fatigue, and respiratory failure. So this is a condition that can affect anyone who's had COVID, of any age, of any severity.
Right, so it's quite unpredictable then. Professor Kwok, some believe though that the symptoms of long COVID after an Omicron infection may differ from those following a Delta infection. What are your thoughts on this?
Well, I would dearly hope so, because as Dr. Tan already mentioned, the COVID-19 long-haul symptoms were primarily unrelated to ages that or even severity for that matter, in regards to the frequency of mild long-haul COVID-19 symptoms. But I'm hoping, just because Omicron is less likely to cause a severe COVID-19, if we can deduce a certain theory out of the study that was published in Nature, that people who were contained in, let's say, ICU beds or admitted to hospital were much more likely, let's say double the times or three times more likely than who did not have COVID-19 to have, let's say, the severe types of long-haul COVID-19 symptoms, such as myocardial infarction or heart failures. I'm hoping that because Omicron tends to comparatively less than before cause severe forms of COVID-19, hoping that also it'll tend to cause less frequency of these long-haul COVID-19 symptoms as well.
Right, but we are not certain.
We're not certain. There are no study that clearly proves any of these findings yet.
Right, and talking about findings, quite a bit of our current findings, Dr. Dan, are based on long COVID, that is, are based on adults and not children. Having said that, I suppose related research on children has been rendered quite challenging, right?
Yes, I would agree. And as I said before, there was a myth that children did not suffer from long-haul COVID. And so because of this myth, there was decreased interest. And because there's decreased interest, there's less research and less funding into this issue. There are also logistical concerns. Children sometimes have a harder time expressing their symptoms, and sometimes research has to be done with parents. Parents need to be sort of the intermediary for the children in research projects. And sometimes parents are reluctant to talk about what's going on in their children, especially when it pertains to COVID. And so there are multiple issues, I think, that are at play, but more and more research is showing that the legacy of COVID in children could be long-term, both health effects and also economic effects that could be lifelong. And so this is definitely an issue that needs to be looked at more carefully.
Right. And Professor Kwak, the causes of long COVID have yet to be fully understood. Having said that, what are your personal thoughts?
Well, so I'm still going back to the reference, the Nature publication, or that I keep referring. That they actually listed a different possible causes or correlated issues that might have caused these long-term COVID-19 symptoms as opposed to just the acute phase of it. And they mentioned anything from, let's say, direct viral toxicity to possible dysfunction in immune reaction to a prior infection. I think, and this is just my pure personal view, that COVID-19 tends to be a two-phased, primarily vascular disease. That's why it causes so much trouble, anything that's connected through vessels. But also at the same time, it causes a lung issue that's more so stemming from immune reaction to the prior infection. That's why if people are not treated with certain regimen of treatment, once a certain time passes, it no longer can be controlled. That's why all these medical regimen that we have in hand so far does not work in those people who already are having severe forms of COVID-19. So I think further studies obviously have to be done to find out exact causes for possible long-haul COVID-19 symptoms. But I think the main focus of it would probably stay in those in the vasculature and also immune reactions and immunity.
Right, and staying with the same question, Dr. Dan, what do you believe is causing this health condition after COVID-19 infection?
Yes, I would agree that probably the immune system, dysregulated immune response, possibly also autoimmune responses are responsible, but also, of course, there are direct pathological effects from acute COVID on organs, on the vasculature, and certainly we, on autopsy studies, we have seen the effects of acute COVID. And we could imagine that the damage done to organs, to blood vessels, would take a long time, weeks to months, to completely heal.
Dr. Dan, how then are long COVID patients treated in the absence of a clear cause behind their condition?
Yes, it's very difficult to manage long-haul COVID patients, but the most important principle is that it must be patient-centered and also multidisciplinary. So a patient should have a thorough evaluation. Specialty referrals should be made depending on what the patient is complaining of. For example, if they have respiratory symptoms, they should be sent to a pulmonologist. If they're having palpitations, they should be referred to a cardiologist. A rehabilitation specialist at the center of care, I think, is very important because a lot of the symptoms have to do with decreased ability to function, fatigue, sometimes exhaustion, post-exertional exhaustion. And so having a rehab specialist involved is very important. And also, there are some mental health concerns as well due to long-haul COVID. We know anxiety and depression are more common in long-haul COVID patients. And so having mental health services available is also an important component of the management of these patients.
Right, I see. Professor Kwak, research by UK experts reportedly showed that those who were vaccinated were less likely to suffer from long COVID. Could you tell us a bit more about this finding?
Sure, and I'm going to add on to the study done by the UK, another study that actually found also a very similar finding, also out of Israel, that they had clear evidence that people who were vaccinated compared with those not vaccinated showed much less frequency of continuing to have symptoms after acute phase of COVID-19. And I think that it's mainly due to the severity that they went through the disease because, as we all know by now, vaccines do at least, if not just stopping the transmission, they at least reduce greatly the severity of COVID-19. For those people who are vaccinated are much less likely to be admitted to ICU beds, much less likely to have severe forms such as shortness of breath and whatnot. So there are, and out of that speculation, these studies have hard proofs that those vaccinated will also be much less likely to continue to have COVID-19 long time after. Further iterating why we need to vaccine those people who are vulnerable, but also the fact that why we need to allow children between 5 and 11 years of age to be allowed to receive vaccine in Korea as well.
Right, we have yet to give that green light then. Dr. Tan, what do you recommend to allow for a productive study into long COVID here on the local front as we look ahead to a possible post-pandemic future?
Well, I understand here in Korea, the National Infectious Diseases Research Center did start a study looking into long-haul COVID in Korea. They started last September. The results are still forthcoming, and so we should await those results. But what we need is really a multi-center research project in all parts of our country. Of course, it should be in terms of the time span, looking at not just the people who were infected early on, but throughout the course of the pandemic, and see if there are really differences due to the different variants that have passed through our country. But I think the most important thing to let our patients know is that when they have symptoms, they should not try to rationalize, they should not ignore them. They really need to come forth and let their doctors know what they're feeling. And doctors, we can't ignore what our patients are saying. It needs to be well documented, and hopefully we will have a post-acute COVID specialty treatment center, not just in Seoul, but in all the metropolitan regions around the country, so that the people who suffer from this illness can get the care that they need.
Right, so strengthening or bolstering efforts to treat these long COVID patients will be essential then. All right, Dr. Dan, as always, thank you very much for your thoughts. And Professor Kwak here in the studio, thank you for being with us today.
Thank you.